job advisors in hospitals to get mental health patients back to work. I'm going to read into this piece from the Times, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from the Times with the headline that job advisors in hospitals to get mental health patients back to work. Ministers want to expand a pilot scheme that encourages doctors and nurses to think of finding work as a key goal of treatment. Guys, while you're here, make sure you hit the like button and share this across social media so others are notified of this video. So before I dive into this one there, let's have a step back and think about this. So they want to put job advisors in hospitals. Now just think about that. To get mental health patients back to work. Now how exactly is this a good thing? Now the part of me feels like is that those who are struggling and those who are suffering right now, do you really want to have somebody in the hospital thrust upon them, encouraging them, you need to get back to work, we need to get you back into work? It's like kind of that kind of mindset doesn't sit right with me at all. I understand that we have a crisis here. We don't have enough workers in jobs, have enough workers for certain sectors. I understand that, but we're talking about people who have serious mental health problems. There's all sorts of reasons why they have mental health issues. Some of them because of being a divorce. Some of them could have been because they had a big job and they've lost it. So it can be all sorts of reasons. Some of them may be financially struggling, which a lot of people are financially struggling due to this cost of living crisis as well. There are all sorts of reasons around it. Now, to me, I don't like the sound of this at all. I don't like the idea of somebody talking to you if you're on a bed or whatever, and you're not in a job and you're relying on benefits, and someone trying to encourage you, whatever your situation is, encourage you to get back to work and advice and whatnot to help to get back into work. I know I can understand if some people see it as a positive thing, but I just don't think this should be something anywhere near a hospital. Especially, you don't know, like the advisor who will be talking to you don't actually know the state of them, the situation that some of these people are in. And it just doesn't sit right at me at all. I just feel like it's another a quick scheme to try and get more people into work when, like, this is something that's going to take time. You know, we've had 14 years of austerity. We've had so much damage to the UK economy from COVID, from the war in Ukraine, and from Brexit. We have lots and lots of people right now who are struggling to get back into work as it is. And this just comes across to me as to trying to push people in it, when at the moment you need to get things back on its feet. You need to the Labour part, the government need to get things back on its feet. The state needs to get things going, and this idea just doesn't sit right with me at all. It just feels rather than, oh, this is a great idea, this will help. This feels like to me more of a push idea to push people into it, and especially mental health patients as well. And this is something I'm extremely sensitive about. I do think there's jobs out there for them, for jobs out there for them, but I just don't think the hospital is the right environment to be having these conversations in any way, shape, or form. That's my position. So let's read a bit more into this, you guys. So, employment advisors will be stationed in NHS hospitals under plans to make finding a job an essential part of mental health treatment. So ministers are planning to focus NHS care on helping the long-term sick back to work, saying it's essential to growing the economy and bringing down the benefits bill. It's not. This is not the central thing to grow the economy. It's an aspect of it, but it's not the be-all to end-all here. There's a part of this I understand why, but there's also a part of this is like, there are much bigger things that you can be doing to grow the economy, and I don't think this is one of them. Mental health problems are the fastest rising cause of disability, and ministers believe it will offer tangible benefits to many patients at the time as controlling spiralling costs to the taxpayer. While the Conservative government arguing with too many mental health claims were a result of over-medicalising problems. Labour insists that the rise in mental health problems are real. However, ministers fear that many young people are being written off by the NHS and a benefits system that does too little to encourage them into work. I just feel, a part of me feels like that this is being, I feel like this is, my fear is that that while the Labour government acknowledged the systematic problems of mental health, I feel like this is almost a pushing people rather than actually talking about it and understanding why people have these issues and how to address them so that they are able to go back into work, rather than actually just kind of pushing it upon them that they need to go back to work. I feel like, the conversation around mental health and about helping them is being missed out in this. Liz Kendall, the Work and Pension Secretary, and Wes Streeting, the Health Secretary, want to expand a model in place at the Maudsley Hospital in South London, which uses employment advisors to offer its patients to help looking for work, writing CVs, doing interviews, and linking them with local employers. There is clear evidence that good work is good for mental health. With 2.8 million people currently locked out of work due to ill health, we need now radical reform to get Britain working again, a government source said. The work happening at the Maudsley is a good example of the need to join up mental health support with employment support to help people on their path back to work. The model has been shown to get 55% of patients into work, compared with 28% of people offered normal treatment, and is used by GPs elsewhere in the health service. But NHS sources say employment advisors are often seen as peripheral to care and are not often taken seriously enough by doctors in specialist mental health services. Next month, the Maudsley will start a pilot backed by NHS England that embeds employment support in mental health clinics and encourages doctors and nurses to think of finding work as a key goal of treatment. This conversation should not be This conversation should not be brought up around doctors and nurses. I don't agree with this at all. I really don't. So Norman Lamb, the chair of the Maudsley, said it's a cultural shift we need in mental health service so that every clinical team across the country is thinking employment is a legitimate and important goal of recovery for people. I'm not saying getting people back to work is not a good thing, and I know being in work is actually good. It's good for your mental health because it allows you to get your mind off whatever problems that you may have. It can stimulate you and motivate you if you actually are passionate and whatnot about your job. I'm totally understand that point of view. I just don't agree whatsoever with this assessment that this conversation should be happening inside an NHS hospital. I don't agree with that at all. I'm worried that the kind of people that have been pushed, the kind of people that are in the job centres, who are working for the DWP, some of the vile people that have been working under those departments for 14 years under Conservatives, some of them have been very cruel, very vulgar towards people who are claiming benefits. I'm worried that these are the same kind of people that will pop up in these employment boxes and NHS hospitals to try and push them in. That's my fear. And I don't like that at all. This conversation about getting people back into work should not be done around a hospital. And the conversation should not be around doctors and nurses, in my opinion. This is not about forcing people into employment. Well, it certainly comes across it that way to me. Or doing anything that's not right for them. It recognises the importance of people, of the dignity and self-worth that the employment brings, but it also enlightens the self-interest because it reduces the burden of the NHS. Everyone wants to reduce the burden of the NHS, but doing it in the hospital is not right in any way, shape or form. Ministers are watching the pilot carefully with the hope of expanding it across the NHS. I'm not in favour of this at all. It comes after the NHS started offering job coaches to patients with depression, although only about 6% of those referrals have attended employment sessions. Streeting has said that his reforms to the NHS would be focused on moving the dial on our growth mission, promising to get sick Brits back to health and back to work. Kendall was promising to link employment support with the NHS, arguing that Labour Party conference last week that the only way to get Britain growing again is to get Britain working again. Lamb says the new model of care closer to home was designed to be very different to the hospital setting, and it is less medicalising of people's expenses, and it's accessible and not just by appointment. He added, we will work with community-based organisations, including employment advisors, and people will be able to work with them to get them into work. So employment will be part of the mission. The ultimate objective is, if we can demonstrate it works, that this becomes the new approach to mental health. Such reforms are also seen as crucial to controlling the rising cost of sickness benefit which are projected to reach 64 billion by the end of the Parliament. The increase of almost 30 billion on levels before the pandemic. Again, I'm totally in favour of reducing sickness benefit and getting more people back into work. I'm just not in favour of doing it at the hospital. New claims for mental health problems have doubled since 2019, driving a big increase in the number of young people on disability benefits. Some 34% of new disability benefits awards are now primarily for mental health problems, up from 28% before the pandemic. New figures show that 300,000 people stopped working due to poor health every year, with millions more at risk dropping out of the employment because of illness. The Health Foundation said employers must do more to deal with the rising number of people suffering health problems that limit their ability to work. 1 in 5 people of working age report a condition that affects their work, up from 1 in 7 a decade ago. There are 3.9 million people in work with such a condition, and they are 3 times more likely to drop out of employment, the think tank warns. Once they are out of work, only 4% of people with such illnesses get back into jobs each year, a rate 3 times lower than healthy people. As someone that suffers from mental health, I'm all in favour of encouraging and getting more people back into work. Now, they stress here in this article, and I'm pretty sure they will stress it publicly, that they're not forcing people. But that's not how I see it, because you're doing it in a hospital. Now, people may counter-argue and say that it does help. But there are certain situations, there are certain patients who are in these situations where that you can't just have that conversation with them, that they're not ready to have that conversation about getting into work. There are lots of different factors, and every single case is different. And I just don't think, a hospital is the right environment for them to be having this conversation. I don't see it as encouragement in helping people back into work. I see it more as forcing. That's how I see it more, and it definitely stinks of that to me. It definitely stinks of that to me. I don't think it should be anywhere. I don't think pushing people into work or having conversations about employment should be anywhere near the hospital. The whole point of a hospital is there to be, you're supposed to be treated and looked after, be cared for, not to have a conversation about work, about getting employment, getting jobs. You should not be having, and that conversation, why is that conversation needs to be done with doctors and nurses? I don't know. As if they got enough problems on their plate as it is. Don't you think the doctors and nurses have enough on their plate as it is? I don't agree with this assessment. And the argument, obviously, about getting more employers, getting more people back to work, this will not fill the gap. We all know that we need more workers abroad. Everyone knows we need more workers abroad. We don't have enough. We don't have the skills to get skilled people to get for some of the jobs in the UK. There are just people in the UK, or in England in particular, that just are not capable of doing certain jobs that we have vacancies in, that you just can't get them back into. And that's just a fact. The numbers are there. There's not enough British people to fill the gaps. That's the reality. We need foreign workers. That's the reality. If you want to grow the economy, you've got to get foreign workers in. And it just feels like this is just a scheme to try and help plug the gaps. But it's not going to plug the gaps. There's still too many holes. That's how I see this as. But I'm sure some of you may disagree with me. But let me know what you guys think down in the comment section below. What do you think about job advisors being in hospitals? Do you think that that's a good thing? Do you think it's a bad thing? Do you agree with me that perhaps they may be forcing people, as a trying to way to force people into work? Do you think doctors and nurses should be a part of those conversations? Let me know your thoughts and more down below. If you found this video interesting, please hit the like button. We greatly appreciate it. Share this across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing because it really does help support the channel. If you want to go one step further and financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.